Hello friends, today we are going to discuss about the most important topics for upcoming NEET examination for the subject of psychiatry. So firstly, I think the most important topics in here is the delirium and dementia. So just the difference between two is very, very important. You have to remember, in case of delirium, there is a very important line, that is the alter sensorium. Okay. That is the alter sensorium. You have to remember, it is very, very important. And in case of dementia, you have to remember there is a clear sensorium. This is the how you have to differentiate. In case of the one of the in case of previous year NEETPG, there was a question on what is the neurotransmitter decrease in delirium, that is the acetylcholine. Okay, so you have to remember it also, but in case of dementia it is decrease in acetylcholine and increase in glutamate. Okay, so you have to remember this. And there is important that in case of delirium you have to assess it by the method of CAM, that is confusion assessment method. Okay, and one of the most important is there is a evening worsening of symptoms. Just remember this is very, very important. Evening worsening of symptom. And here in case of dementia there is 2 out of 4, that is the aphasia, apraxia, agnosia, and loss of executive function, that is planning, organizing, and sequencing. Okay, so this is very, very important. And these 2 out of the 4 you have to present with amnesia, and the amnesia should be new learning as well as remote learning, that is the remote memory. Or in case of delirium there is the only the new learning affected. Okay, so these 2 is very, very important. And the third topic is the Korsakoff amnestic syndrome. And here you have to remember that it is due to thiamine deficiency, and there is a confabulation, that is fill gap in recent memory. Okay, so this 3 topic is very, very important for examination. And the next thing I am going to discuss is the most important, is the various personality disorder. Personality disorder. This is very, very important topic, and just you have to remember the various examples like schizoid, schizotypal, in case of schizoid there is a social isolation. I will discuss it in few minutes. Paranoid, borderline, histrionic, antisocial, narcissistic, avoidant, dependent, and OCPD, obsessive compulsive personality disorder. So examples are schizoid, that is the social isolation. Okay, Physiotypal, the magical thinking. Paranoid, suspicious on others. Okay, borderline, like cut wrist to make his statement to others. Okay, histrionic, this is the attention seeking. Antisocial, you know, like gangs of gossipy peoples, that is the like love to break rules, and you have to know it is very, very important, it should be always more than 18 years. Okay, and next is the narcissistic, that is the only self-love. Avoidant is the avoid social demanding situation. Dependent is the lack of decision making. OCPD, preoccupied with rules. Okay, so this is about the personality disorder. It is also, I think, very, very important. And the next important topic is the psychosis. In case of psychosis, I will especially tell the most important is the schizophrenia. And here I just want to tell you, you have to remember the neurotransmitter, what is the effect. Okay, so it is very, very important, you have to remember neurotransmitter, you have to remember. And the next thing is the duration, that is less than 1 month, 1 to 6 month, more than 6 month. Okay, so according to ICD-11, DSM-5. Okay, so in according to ICD-11, it is acute psychosis, schizophrenia, here it is brief, psychotic disorder, schizophreniform disorder, and here it is schizophrenia. And just read the remaining of the schizophrenia various types, it is very, very important. Types of schizophrenia, I am not going to details, but just I want to especially mention in one type there is total 4 types is present, but I am going to discuss about the catatonic schizophrenia, because there is the different in management. Catatonic schizophrenia, because there is the treatment is like different, that is treated by IV lorazepam. Okay, and rest you have to go for the details, and in case of rest the treatment is different, that is the atypical antipsychotics. If not respond, then typical psychotics. If not respond, then clozapine. Okay, so just go through this topic, and it is very, very important. I have just highlighted the most important topics for you. Okay, so this is very important. Next is the neurosis. In case of neurosis, there is total various diseases, but I will especially want to tell you that the most important is the NGS disorders and the phobia. Just read the whatever the phobias, okay, panic and phobia, and you just acrophobia, it is for height, mesophobia, that is for dirt. In case of hematophobia, that is for blood, like that. That is nyctophobia, that is I think it was came in 2020 NEET exam, that is for night. So just go through this topic. And OCD and related disorders. I here important to want to highlight related disorders, that is due to overactivity of corticostriatothalamic loop. Okay, just one of the most important line, I think. So I have just told you, just go through this topic. And next is the trauma related. So here it is total 3 types: acute PTSD, the post traumatic stress disorder, and adjustment disorders. Okay, adjustment, it is less than 1 month, okay, more than 1 month, and PTSD, it is okay, and this is the adjustment disorders. Okay, so this is very important topic. I think you have to remember this is by your heart, and accordingly examples you have to remember. Okay, and in adjustment disorder, it is onset is more than 1 month. Okay, here also. Okay, so this is also very important topic. And next, the important topic you have to remember is the 5 is the various dissociative disorders. So just the various examples like dissociative fugue, dissociative personality disorders. Okay, তারপরে হচ্ছে depersonalization and derealization. And here just I want to important about the as if phenomenon is present here, as if phenomenon. Okay, so go through this topic, this is also very important. And okay, I think this is sufficient for the various neurosis disorders. And the next thing I want to discuss, that is the mood disorders. Oh, sorry, I just want to highlight what is the treatment of choice for various neuroses. That is the SSRI. And I just want to tell you, please go through the side effects of SSRI. And especially you have to remember, there is a dryness of dry secretion, like dryness. It is repeatedly coming in your exam. There is no salivation, this dryness of secretion. Okay, so this is very, very important. And next thing is the mood disorders. So accordingly you have to read the manias, PPT, and depressions. You can't skip this topic. This is very, very high link topic, and I think you have must go through the topic. And but just the various types, like in case of bipolar disorder, you have to remember there is what is bipolar disorder type 1, what is BPD type 2. Okay, just remember. And also you have to remember there is a what is the treatment, that is the mood stabilizer. Okay, So this is regarding the mood disorder topic. In case of general psychiatry, I want to especially highlight general psychiatry. General psychiatry, you have to remember the form of thought disorders. Form of thought. Next is the content of thought. And I think these two topics is very important. There is also various things like that in your in case of psychiatry. You can, if you have time, you can like the position of thought and stream or flow of thought. But I will especially tell you that in case of there is a form of thought is very important, and content of thought. And here the various types. I think already in the previous year NEETPG there was a question. NEET 21, there is already a question from the form of thought disorders. Form of thought. So it is very important, like night move thinking, like loosening of association. And I think NEET 21 question was the derailment question. Derailment, that is the form of thought. Okay, so this is very important topic. And content of thought, just go through this topic. And I think if you have time, you can go through the rest, but this is the most highlighting. And one thing I want to especially highlight, that is the, in case of if it is come, that is the mini mental state examination. That is total 30 is the score. If less than 24 out of 30, that is signify there is a dementia. Okay, and there is various things. So if you have time, you can go through the MSc testing, but not so important. And I think I have covered the things. Yes, one of the most important, I have just forwarded, sorry friends. Thus the most important question is the sexual cycle. Sexual cycle. Just remember ejaculation in orgasm state, orgasm phase. Erection in arousal state, arousal phase. Just go through this topic, it is also very important. And you have to remember the treatment is the SSRI. It is also very important. And I think there is some questions regarding postpartum psychosis, like postpartum blues, postpartum psychosis, so these topics are also very important. And also the things like various EEG findings. And in EEG, I just want to tell you, in case of NREM stage, just remember in NREM 2 is the longest phase. In case of 2, there is a bruxism is present. Bruxism, that is the grinding of teeth. Okay. In case of NREM 3 and 4, you have to just remember there is a nocturnal enuresis. Somnambulism, that is the walking somnambulism. And one of the one year there is a NEETPG question, in which age group, especially in the child. Okay, nocturnal enuresis question already came. What is the treatment? Bed alarm. Okay, and somnambulism, nocturnal enuresis. In case of REM, I just want to highlight, in case of REM, you have to remember there is rapid eye movement, number 1. EMG, electromyography, is absent, that is the negative. Next is the nightmares, Okay, that is we can memorize. Okay, so I think this is the very important for your EEG findings. And also, if you have to time, just remember the various alpha, beta, delta, theta. These are the various waves you have to remember, and it is very important. And this, just go through these waves, what is it, and especially about the especially about 1.5 to 2.5 hertz, that is the Lennox Gastaut. 2.5 to 3.5, that is the absent seizure. And 3.5 to 4.5 hertz myoclonic seizure. Okay, myoclonic seizures. Yeah, this is very important. Just go through this topic. And I think in case of just for the sake of knowledge, important, alpha is the 8 to 13 hertz, beta is the 13 to 30 hertz, delta is the 0.5 to 4 hertz, and theta is the 4 to 8 hertz. So I think this is the one of the most important topics I have just discussed, and this you have to include it in your last minute revision. So if you like this video, please share in your friends. So thank you, friends.